Hi guys, hi everyone, I'm Dr. Seb. Thank you for watching Tanya Dr. Seb. Today, I would like to share with you about flesh-eating germs. Let's see the VR.
Hi, good day everyone. Flesh-eating disease are dangerous. It started with an infected small wound and later extend to the whole limbs. If the infection is not getting attended, the patient is at risk of limb amputation and may be lost to life. Wound infection is treatable. Please do not delay and seek for treatment as soon as possible. Let's Dr. Seb share with you more.
Recently, we have heard about news reported in Singapore that there is one of the patients, the fingers was being amputated is because of one dealing with some seafood, and the seafood actually is more to the prawns and that stunk the fingers, and later on the finger got infected and later on being amputated. So also there is a lot of patients come to us with a lot of complication on the foot because of they have diabetic and they have injuries. They couldn't take care of the injury properly because they have no sensation, and later on the germs that infect the wound and cause the wound worsening. And usually this type of wound should be taken care well, because once it infected and was not properly handled, definitely the wound will get worsened and it will lead to maybe the worst outcome, limb amputations. So what is this flesh-eating germs consist of? It can come from bacteria, can be virus, or can be a fungus. So for bacteria, there is a lot of type of bacteria such as like Staphylococcus aureus, Streptococcus species, gram-negative rot such as like E. coli, bacteroides, and some saltwater bacteria such as like Vibrio bonificus, and those oxygen deprived, which is anaerobic organism such as like Clostridium perfringens. For virus, there's a famous one which is the Ebola, and for the fungus can be Aspergillosis and also Candidiasis. How this infection started? Usually it started with a small wound over our limbs such as like leg, our hand, or even our perineum region, the groin region. So it started with a small wound that infected by the organism that I mentioned just now, and it started with the superficial skin infections, and the bacteria go into the lymphatic drainage, and slowly the infection spread and block the lymphatic drainage, and the whole area perfusion will be stagnant. When it's stagnant, the cell of the wound will slowly die off, and when it die off, all these pathogens like to eat this type of flesh, and they will start to multiply more, and it causes more harm to the tissue, and they eat up more, and this infection will get worsen and worsen, and later on this bacteria go under the skin and track under the skin and go into the deep tissue, and it go into the superficial layer of membrane, we call it the fascia. So then the bacteria will stay inside there, or those pathogens will stay inside there, and slowly build up some of the abscess under the skin, and then this will create a very nice environment for other bacteria to come in, and this infection will mix with other bacteria and cause super infection, and later on those anaerobic bacteria also come in and they eat up the deep tissue under the skin. So when this happens, there's a lot of gas formed under the skin, and it separate out the deep tissue from our deeper layer of the muscles, and it causes a lot of gas bubble under the skin, and which when we touch the patient's skin, we will feel that there is like a bubble plastic popping sensation. So this infection will go into track up and up and up and further deep inside the tissues, and it causes we call a condition called necrotizing fasciitis, which is the above the fascia, all the tissue was die off, and there's abscess tracking into the limb. And when this infection getting worse and worse, the bacteria will enter the bloodstream and go to the body and spread around the whole body and causes, we call it sepsis. And during this condition, before it becomes a sepsis, usually doctor will do some treatment. If not, then the sepsis getting worse. This condition will cause a life of the patients. Who is the one who at risk on getting the disease? So usually those patients who are immunocompromised, such as like a cancer patient who are already on chemotherapy, diabetic patient who are not well controlled, the patient who are on steroid treatments, or those patients who are at extremely ages, which is a bit elderly, and those who are currently having sickness and not recovered yet. So this group of patients definitely have high risk of getting this super infection and might lead to limb amputation and later die of sepsis. What should we do when we found our loved one or ourselves having a wound which is infected? So when we found that wound is superficial and the wound is infected, first of all, the wound should be cleaned up or dressing daily. So we should use normal saline dressing, which is our saline content of sodium chloride, and you can easily available in any pharmacy. And you just every day wash the wound morning and night time. Wash until it clean and watch out for any pus that come out. If there is some pus come out, then we have to wash it away with the normal saline. You also can advise to use some flavin. Flavin is some yellow color external application solutions. It can have some antiseptic property that you can just wash it again and again with the normal saline and then apply a layer of flavin. So if the wound didn't get better after you have do daily dressing, you should seek a doctor to have a look on the wound. Sometimes maybe you need a surgical intervention like wound debridement, which is you have to go into a small operation theater. They give you some local numbness, the medicine to numb you locally, and then later on they will slowly cut off all the dead meat around the wound or the infected unhealthy meat. The doctor will remove it with some operation such that they cut it out. And later on, they will do some dressing in hospital or even in the nearest clinic every day. So they will monitor the wound from time to time until it heals. And doctor might start some antibiotics after the wound debridement to make sure that the bacteria were under the control, which is under the antibiotic treatment. If the situation getting worse, which is the infection is too deep under the skin and gas bubble form under the skin or under the flesh, so doctor will suggest a patient to undergo a major surgery, which is they will give you or give the patient totally sleep under general anesthesia, and they will do a major wound debridement and drain the pus under the skin. However, after this operation was done and found that the skin or the tissue under the skin is still not healthy and the infection getting worse, then a limb amputation might be the choice to treat the patient, because limb amputation saves the patient's life. We had a lot of cases every day seeing that the patient infections on the wound was not cured, not properly handled, and end up to have limb amputation to save life. This is what we don't want. That if let's say a patient able to come earlier to seek for treatment, definitely the limb can be saved, and definitely the patient won't go into sepsis, and definitely the patient would die on this infection. All these organisms can be killed by simple wound dressing, wound debridement, and antibiotics. For those who are diabetics, definitely sugar control on the blood is very crucial for this. So a diabetic patient should usually admitted for this type of infection, and the doctor will give some will monitor the sugar level while giving the insulin. Early recognize on the wound definitely save life. So we need to really take care of our loved one and always look at their food and their wound, and always take care of their wound when it got into an infections, and also to seek treatment as soon as possible when you see the wound is not healing well. Thank you.